right, so basically what we're going to be doing now is a tape for a hyperextension injury on the wrist. This is going to be, works out well for any of the FUS injuries, TFCC injuries, hyperextension. Normally they're going to present with some dorsal wrist pain or pain in the ulnar corner. Usually they'll tell you it's like from pushing positions will make them feel worse. So the patient we have today is actually getting pain on her push-up. She has difficulty with extension, and we're going to test her first to make sure the tape job that we normally use for this is going to be effective. There's no point in putting tape on people for an injury unless you know it's going to work ahead of time. So everything should have a pre-test, a tape job associated with that pre-test, and then a post-test to make sure it's worked. So we're going to have our patient actually assume that push-up position, and we're going to just tell her that that's a 10 on the pain scale. So that's her 10. Now what we're going to do is have her unweight it. We're going to relocate that joint, which is exactly going to mimic our tape job. And now from there, she's going to resume her push-up position. And what we're looking for is on the functional test that we get about a 50% reduction in the symptoms. And if we get that, we know the tape job is going to be effective, which we had with that. So let's show this tape job. Excuse us, guys. Yeah. All right, so the first thing that we're going to do is we're going to measure right around the wrist, and we're going to cut 2 of those. Now, if you want to save yourself some time with cutting, always just cut right, measure the tape, cut it right in half. We're going to make 2 1-inch strips, so once again we fold the tape in half and cut. We're going to round these edges so that the tape doesn't catch any clothing. All right, now, what we're going to do with this tape job is we're always going to be starting the tape on the radial surface, and we're going to be using the pisiform, and we're going to be using the distal ulna as our fulcrums in order to relocate this wrist. So the first one we're going to do, we're going to start on the radial surface, dorsal side. And what I'm going to do is relocate the joint myself. And actually, I'm just going to switch my body position for a second. We're going to relocate the joint using 1 finger on the pisiform, 1 thumb on the distal ulna. No tension on the tape until we get to the radial surface. And then what we're going to do is do a 100% pull, get around that pisiform, and then no tension on the tape the rest of the way around. We're going to do that same exact thing, except now radial surface, coming underneath the wrist. Once again, we're going to relocate the joint.
Make sure you come back and let me know how that feels.
I will. 100% tension.
Thank you very much.
Right over the distal ulna. And then with our second strip, we're going to break that tape in the middle. 100% stretch on that. Go right over the joint. Lay that down, paper off tension after you've gone. So the only 100% stretch is right here. Once again, our exact stretch indicators can give us a sign that we've actually hit that tension. And we're going to let that be paper off tension so that the hand can't go numb. Now we're going to have her resume her push-up position, and we're looking for that at least 50% change, most likely more than that once the tape job's been on. And one thing you can see that she did immediately is she actually put the arm in a good extended position. She wasn't trying to compensate by changing the position of her forearm. So that's going to be our taping for an ulnar triquetral joint laxity or instability, or again, TFCC tears or hyperextension injuries.